Hello, I am Dr. Mirela Cerneanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Welcome, listener, to the part 2 of our episode series regarding autoimmunity. Is this the new epidemic? And I discussed in the part 1, in the previous episode, I discussed what is autoimmune disease, what types of autoimmune diseases we know that are out there. I made the connection between autoimmune disorders, autoimmunity, and leaky gut or a damaged gut barrier. We talked a little bit about how leaky gut is caused by stress, why women are much more prone to stress than men, and possible solutions, and talked a little bit about the magic hormone. I love this magic hormone, and it's really not talked about enough. And then in part 2, I would like to discuss our immune system's role in autoimmunity, give you a little bit more information about our immune system, and discuss possible solutions to reverse course and hopefully cure autoimmune disease, and specifically nip autoimmunity in the bud before it turns into autoimmune disease. So I'm going to start where I left off last week, and I'm going to discuss a little bit about autoimmunity and our immune system. So to understand autoimmunity, we need to know more about how our immune response works. I'm going to dive right in, give you some facts and information about your immune system. In the last episode, as I mentioned, I spoke quite a bit regarding our intestinal lining barrier damage causing a leakage of foreign molecules, foreign antigens, into our bloodstream, our circulating blood flow, and stimulating an immune response. The immune response generated against foreign invaders can be either cellular or humoral. Now, it's humoral, not hormonal. It's a little bit of a difference. So let's talk about the first type, the cellular response. The cellular response involves cells like our T cells, our natural killer cells, our macrophages. It's a bunch of cellular reactions that are initiated by the exposure to foreign antigens. There are different ways to quantify this type of cellular response, but this type of response is non-specific. We don't know where the attack is happening, even if we can measure a cellular response and we notice that it's increased and activated. Also, the downside of checking if we have a hyperactive cellular response is that the majority of the tests, the laboratory tests that are targeting this type of immune response are pretty high-tech at the moment. They're not really available for day-to-day testing through major outpatient labs. Now, a very simple test, and it's very telling, is just looking at a CBC, our complete blood count. If your doctor knows how to interpret the CBC, this specific test can provide important data about cellular inflammation and immune activation. You can also measure the T cell count by ordering a CD4 lab test or a CD4 to CD8 ratio, which looks at how many helper T cells you have in relation to the cytotoxic T cells. There is a blood test available to measure natural killer cells, which are a very important marker for an activation of a cellular response, as well as an indirect indicator of chronic inflammation. But the measurement of the natural killer cells is pretty expensive, not frequently used. So again, what's important is how do we know that we are mounting this response and other tests to measure these responses? So let's talk about the humoral response, which is not, again, hormonal, but humoral. And it actually consists of antibodies. So now antibodies are much more specific and very easily identifiable by laboratory testing. Who hasn't heard of antibodies? We have antibodies to a lot of things, including bacteria, viruses, and many people became fascinated with whether or not they had COVID antibodies after the pandemic broke loose in 2020 and after vaccination for COVID. So we all know about antibodies, but let me give you a little bit more specific information about what type of antibodies do we have and why some are more important than others. There are 5 types of antibodies, and for educational purposes, let me mention all of them. IgA antibodies are secretory antibodies. This type of antibody is primarily secreted by our mucosa in the mouth, in the intestine, and the vaginal lining, and it may also be found in the breast milk. This type of antibody binds with the bad molecules to identify them as ready to be destroyed. It also is very important because it prevents the bad molecules, or foreign antigens, from sticking to our intestinal and vaginal lining. So it's a first line of defense, really important. IgM antibodies are a type of antibody that are initially recruited in defending us from a specific infection. A high IgM antibody response signifies an initial infection. After an initial surge in IgM antibodies, the body will then produce IgG antibodies. Immunoglobulin G, IgG antibodies, are our long-term antibodies. These are the most abundant antibody type that exists in nature in our human body, and they freely circulate in our bloodstream. We can make these antibodies against pathogens like viruses, bacteria, food particles, and unfortunately, we can make these antibodies against our own tissues when we develop autoimmunity or autoimmune disease. Immunoglobulin D is less well known and very poorly understood. It accounts for a very, very, very small percentage of our circulating antibodies. Immunoglobulin E, much better known, is responsible for an immediate allergenic response. This is a very specific immune response that triggers a cascade of events responsible for allergic reactions. This type of antibody helps protect us from parasites, and it's also elevated in the presence of Candida. Let me give you an example of an immediate response and what situations you might see it in. For example, when you're allergic to peanuts and you consume or get exposed to peanut dust, your body is immediately going to trigger an IgE-mediated immune response. Bottom line, your mast cells will release large amounts of histamine. These are immune cells that contain, let's call it a substance, which is histamine. And this will create an allergic response leading to a rash, a drop in your blood pressure, swelling in your throat and tongue, impacting your capacity to breathe. Unfortunately, the drop in blood pressure will decrease blood flow to your brain, which might cause you to pass out. This is a typical anaphylactic response, and this is always IgE mediated. This response can vary in its severity, allowing sufficient time to administer an antihistaminic like Benadryl or an epinephrine, reversing the changes I mentioned above, stopping the immune response, and allowing survival of the person experiencing such a response. Now, this is a perfect example of an exaggerated immune response that can have very impactful and very negative effects on the body. A different type of response, also IgE mediated, but much milder, is when people are sensitized to seafood or iodine. They eat either shrimp or other types of seafood, they get exposed to iodine, and they develop a rash. The same reaction happens if somebody's allergic to, let's say, strawberries. So a food allergy that is mediated by IgE antibodies is going to give you a rash and possibly some more of the symptoms I mentioned. And this is immediate. you will know if you ate something that you're allergic to, that you are allergic to that food. However, when the body responds, not with an immediate type of response, mediated by IgE, but the body responds with a delayed response, consisting of IgG antibodies, for example, the effect of these antibodies is subtle and is slow, and it develops over time. So when you eat something and you might be food sensitized, it's extremely difficult to pinpoint the food source or the food type when days after you ate something, sometimes weeks, you feel more tired, more achy, more foggy, more constipated, more loose stools, etc. Everyone knows that when you have some form of joint inflammation in the form of arthritis, whether it is degenerative arthritis, which is osteoarthritis caused by age, or autoimmune arthritis like rheumatoid arthritis or psoriatic arthritis, nightshades are really bad for you and can worsen the inflammation. And if this is brand new information for you, please be aware nightshades and joint health don't go hand in hand. So why is this? Most likely because in these cases, the person that has such a reaction is sensitized to the nightshade family. This type of sensitization reaction occurs via a delayed response caused by IgG antibodies, and sometimes a delayed cellular response. More and more specialty labs, including mainstream labs like Quest and LabCorp, are offering and have available different panels for food sensitivity testing. They can vary from a very limited number of foods, like 10 or 15, all the way to 400 foods and spices. Obviously, this type of test would be very useful in determining what type of foods to avoid in order to allow your inflammation caused by these antibodies to subside, because it will cool off your immune system. Now, I jumped ahead a little and talked about these delayed antibody responses to foods, but I didn't explain exactly why you form these antibodies against self-tissues when your gut lining is broken. So let me do just that. We talked in the last episode about a compromised gut lining barrier, leaky gut. I talked about the connections between the cells, and I talked about how fragile this barrier and these connections are. Intestinal hyperpermeability is also called and known as leaky gut. You might have heard of this term, and I described it quite a bit in the past episode. All the foreign molecules that come through the leaky gut, the body's immune system will recognize them as being foreign and will activate some form of immune response. If your immune system will continue to get bombarded and stimulated by these foreign molecules because of the leaky gut barrier, it will develop a little or more of PTSD, post-traumatic stress disorder, which means it becomes hypervigilant and it will become dysfunctional. This hypervigilance or hyperactivation of the immune system will lead to the body creating an immune response, making immune destroyer cells or immune antibodies against tissues or part of our own cells that are remotely similar structurally to the invader foreign molecules that have gained access to our circulation and came in contact with the immune system because of the leaky gut barrier. This is also known in the medical world as cross-reactivity. Lately, this theory has been challenged. There are some researchers that focus on what actually happens to the target cells to make them more sensitive to the circulating antibodies. Likely, it's not just the leaky gut barrier. Possibly something happens within the cells of the target tissues, for example, the thyroid, the skin, the joints, that makes them more vulnerable to a strong immune response. Clearly, there might be some genetic predisposition also involved. According to Dr. Malone, a very prominent researcher for autoimmune disease, we need 3 ingredients for autoimmunity: a self-antigen, an inflammatory environment, and an autoimmune genetic predisposition. And according to him, these 3 ingredients have to occur at the same time and at the same place. For example, we can all be exposed to a virus But in certain specific conditions, the response to the same virus can be highly variable. And it can go from 0 signs and symptoms in one person to an extreme immune response and a cascade of inflammation leading to death in some other people. Nothing is more clearly illustrated than the response to the COVID virus that a lot of people experienced during the pandemic. This virus was extremely deadly for some, and it did not affect others at all. Coming back to autoimmune illness, what you need to know is that autoimmune illness is on the rise. And research and recent data shows that there is a huge increase in the number of people carrying autoimmune antibodies, with a particularly high rate in teenagers and young women. Now, this is extremely scary, and it's indicating a possible worsening wave of autoimmune diseases in the next decades. Now, let's consider some of the factors that could be blamed for this. In the past few decades, approximately 90,000 new chemicals have been approved for use. Our use of electronics and electromagnetic frequency exposure has increased to a point where it might impact our health. Our sanitary conditions have changed and have significantly improved compared to 50 or 100 years ago. This can explain why in some cases our immune systems overreact, because in many circumstances there is likely very little exposure to the outside world, making the immune system more naive and more likely to overreact to routine exposures, like bacterial, viral, or different environmental pollutants. So in other words, if you're in your house, isolated, working on your computer, working from home, and coming in minimal contact with people or other factors outside of your home environment, you might be more prone to have a naive, blissfully ignorant immune system that could overreact to the outside world. Now, ultimately, all of these environmental changes, the chemicals, the electronics, significantly impact our microbiome and our gut health, contributing and increasing the risk of leaky gut. So how do we heal autoimmunity and autoimmune disease? Well, the answer is very simple. We really need to heal our immune response, and we need to heal our gut. We do need to do them together. We can't do one and ignore the other. So how do we heal our immune system and our gut? Well, we need to reverse and eliminate the cause that created the problem and allow our body to do the rest. Our body is a major healer. So we need to do something to heal the gut lining and allow the junctions between the cells to come back to normal and tighten. Of course, changing our diet is crucial and can be very effective to help heal our gut. But simply following a diet without addressing the integrity of the gut barrier will allow some relief, but the problem will return as soon as your elimination diet is over, and you will reintroduce the foods that you have previously been sensitized to and eliminated from your diet for 2 months, 6 months, a year. You also have to think about what damaged the gut lining to start with. Was it stress? I talked about that in the last episode, and I talked about why women are more prone to stress than men. Was it maybe a bad gastrointestinal infection? Was it some form of toxic exposure? Whatever it was, it has to be discovered. So a little detective work is necessary. Otherwise, you can do something to heal the gut lining, supplements, elimination diet, etc., and it will heal. But if the situation that led to the compromised integrity of your intestinal lining is ongoing, it will continue to damage it, it will come back to damage it, and it becomes a vicious cycle. What is the conventional medicine approach to autoimmune disease? You need to know about this because you will go to see a rheumatologist or an immune system specialist, and they will offer you some things, and you need to know about what they are and what they do. So number one, your doctor will attempt to control your symptoms. So he or she will most likely recommend anti-inflammatory drugs to reduce the inflammation and help with the pain. These drugs are most likely in the category of over-the-counter NSAIDs, also known as non-steroidal anti-inflammatory drugs, Advil, Aleve, ibuprofen, diclofenac, indomethacin, etc. Number 2, if the inflammation is severe, the best anti-inflammatory that conventional medicine has in their armamentarium is prednisone, a steroid. Prednisone has many side effects, including severe weight gain, increased risk of diabetes, high blood pressure, water retention, and various mood problems like depression and anxiety, sleep disorders, etc. Also, once you get exposed to steroids for prolonged periods of time and their side effects, it's really hard to reverse them once the steroids are stopped. Keep that in mind. Number 3, your doctor might recommend physical therapy and alternative pain control therapies, acupuncture, yoga, meditation. Those are really important, and obviously you should try those before any medication or any anti-inflammatory drug like steroids. Number 4, if you fail the first 3, then obviously painkillers might be a solution for you. Those are in the form of codeine, hydrocodone, oxycodone, tramadol. So they might be recommended at some point, and at that point you will be referred and likely transferred to seeing a pain specialist. Unfortunately, from here to narcotic addiction, it's a very short road. Number 5, immunosuppressant drugs. These are medications designed to suppress the activity, the hyperactivity of your immune system. Medical doctors understand that the key mechanism of autoimmune disease is a dysregulation of the immune response. Therefore, Big Pharma has developed these biologics in the form of monoclonal antibodies. This is a therapy that targets specific aspects and pathways of the immune system response to neutralize our autoimmune reactions. There are many drugs in this category that affect our innate immunity via the complement system that inhibit cytokines like TNF-alpha or tumor necrosis alpha, or inhibit interleukin 1 and 6. I won't bother you with details. I'm an OBGYN first and foremost, and a women's health specialist. This is not a specialty of mine. This is a realm where a rheumatologist likely will know much more than I do. However, these types of facts came to light in my training as a restorative medicine provider and as part of my ongoing anti-aging education. Ultimately, to treat something, you need to understand what is wrong and how things go bad in the body. So I know some information about these, and I'll be happy to share it with you. These biologics have many names, but their generic name usually ends in UMAB. You probably have heard of them during different TV commercials. Cosentyx and Stelara are the most commonly advertised for psoriasis. These medications are extremely effective, and the clinical relief from the severe plaque psoriasis lesions or from the joint pain caused by the autoimmune arthritis can be extraordinary. Your immune system is attacking your own tissues, so why not suppress the dysregulation or a certain pathway in your immune system? It would be technically addressing the root cause. Well, the answer to this question is very simple and very obvious. And I'm going to repeat the question because this is very, very important. Why not suppress your immune system? Because you need your immune system to defend you from everything else. You need your immune system to defend you from infections and from cancer, first and foremost. If you watch a lot of TV, just give it a chance and allow some of these commercials to play. They are advertising on primetime TV for all of these drugs. So if there wasn't a huge need for it, they wouldn't advertise it in primetime TV and spend probably millions in ads. More and more women are suffering from psoriasis, rheumatoid arthritis, lupus, etc. Statistics indicate that a very large number of women suffer from autoimmune illnesses, some men as well. It is estimated that 1 in 15 people in the US have an autoimmune disease, and 80% of them are women. Statistics also indicate that the autoimmune spectrum of diseases and illnesses and autoimmunity is on the rise. Likely our stressful environment, the pesticides we get exposed to, the genetically modified foods we eat, the drugs we take, the poor sleep, etc. They all contribute to damaging our gut lining, and they set up the stage for a dysfunctional immune system. These biologic drugs developed by Big Pharma can be extremely effective at suppressing the immune system, this pathological dysfunctional immune response, allowing significant improvements in the clinical signs and symptoms of the autoimmune condition. For example, a woman can benefit from significant relief from her joint pain caused by rheumatoid arthritis. And if the rheumatoid arthritis affects your hands and is debilitating because you need to do a lot of things with your hands, you can't open a jar, you can't pick up something, you can't write, that's debilitating. So you need help. And these drugs can be very effective. The same type of medication can be used and can provide immediate relief in someone with severe eczema that failed to respond to everything else. Now, what these medications or drugs do is they fail to fix the root cause. Not only do they fail to do that, but the suppression of the autoimmune response will weaken our natural defenses. So if you keep listening to the commercials, it will tell you clearly that life-threatening infections and cancer are ultimate risks if you use this type of medication. So to sum it up, your pain caused by arthritis is much better. Your psoriasis goes away. Your eczema goes away, but you can die of pneumonia. Again, your psoriasis can disappear completely and your psoriatic arthritis is significantly relieved, but you might develop cancer. Some of these biologic medications have a black box warning, which is the most serious safety drug warning issued by the FDA, warning the public about life-threatening risks or life-threatening side effects that might occur with the use of these drugs. Again, a serious risk of infection and the serious risk of malignancy, it's always a problem and a downside when you use these drugs. So in conclusion, let's consider addressing the root cause of autoimmune disease and autoimmunity, which is most likely stress, causing a dysfunctional and compromised gut barrier, leading to a dysfunctional and compromised immune response. Can we use the benefits of holistic medicine, of functional medicine principles, and address and eliminate, after identifying the initial stressor, can we heal the gut lining, use anti-inflammatory autoimmune diets, and possibly take advantage of the modern drugs for the short term while we allow the other healing techniques to address the root cause? Yes, we can do either one, look at it holistically and try to address it naturally, or use the biologics, or we can do both. This is ultimately at the discretion of the person involved, because this is ultimately your body, your health, and you have to decide what's at stake for you. The problem where most people fail to effectively address autoimmune illness naturally and holistically is that it takes dedication and commitment, and it is not cheap at all. It takes time and money to understand the cause, to address the cause, to use the necessary supplements. You need to, again, invest time and money and effort in a completely different way of eating, different type of exercise. You need to invest in your sleep, allowing your immune system and your gut lining to heal naturally. If you find yourself in the situation of having autoimmunity or an autoimmune disease, or you know of a family member or a friend that's in this situation, then you and them will need all the help you can get, because healing is not always easy. But once we understand what the problem is and we are committed to addressing it, all we have to do sometimes is get out of the way and let the body heal itself. So other than spending a fortune on expensive testing, after an expensive consultation with a doctor who does not likely take your insurance for this, and after spending a boatload of money on a large number of supplements, what else can you do? Well, an answer that might be simpler and easier than you think, it's actually peptide therapy. This could be a significant help and an easy way out. Peptides, as opposed to hormones, are signaling molecules. They act super simply, kind of like ringing a doorbell inside the cell or at the entrance of the cell. Whereas hormones have very complicated and very widespread effects on the body. It's like a dance and foreplay type of reaction because they have to have hormonal receptors involved. So it's very complex. So peptides act simply by stimulating directly a specific type of reaction within the cells that they affect. There are specific peptides that address gut healing and inflammation and stimulate a healthy immune response. Now, this would be an ideal way to address the actual problem because it can address all the key factors of the problem: the damaged intestinal lining, the inflammation, and the dysfunctional hyperactive immune response. What are these peptides I'm talking about? Well, stay tuned. In the future, I will dedicate an episode to peptide therapy, what we can achieve with peptides. But for the time being, if you are one of my patients and you would like to have a consultation to discuss peptide therapy, please make an appointment. Let my staff know that you've listened to the podcast and provide them with a code HERAPEPTIDE, and our regular consultation fee of $500 will be discounted to $400. So you receive $100 off. If our practice is in network with your medical insurance plan, we will be happy to discuss peptide therapy with you and bill your insurance. However, keep in mind that any peptide costs will be your responsibility. That includes shipping. And there is no coverage for peptide therapy through insurance at this moment because they're considered experimental. We will have more information about peptides on our website as well, www.herabeautyandwellness.com. Keep in mind that any therapy needs to be addressed in context. We still have to discover the root cause, the main problem that led to the situation you are in, and address everything ideally all at once. We have to identify and address the root cause. We have to change the diet and exercise. We have to address stress. We have to address how you manage your stress, address your sleep, and have to address how do we calm down your inflammation specifically for you. Do you have hormonal imbalances like suboptimal thyroid, adrenal insufficiency, or a suboptimal sex hormone problem? Do you have a growth hormone deficiency, or you have all of these? Remember, without hormones, our body's healing and recovery is limited and impaired, and everything will take longer, and it will be harder and more complicated than if our hormones are optimized. So believe it or not, thyroid hormone optimization, sex hormone optimization, and growth hormone optimization can help your body's natural healing. Again, as our grand finale, I would like to let you know that our body is very complicated and everything in our body is interconnected and nothing works in a vacuum. That's why addressing this important issue with a practitioner who understands it, looks at things holistically, it's much more likely to give you results faster and better, hopefully lasting a long time or forever. I sincerely hope you learned something useful, and some of the information provided has positioned some key chess pieces in place for you, especially if you suffer from autoimmunity. And if you had some aha moments, hopefully the information I provided emboldened and empowered you to take some action and make different choices that can help you heal. So goodbye for now, and I'll see you next week. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.